Well, in this video, I will discuss the peripheral arterial disease. Peripheral arterial disease. Peripheral arterial disease in most of the cases is due to atherosclerosis. In most of the cases, peripheral arterial disease is due to atherosclerosis, but it can occur due to emboli. But when it is due to atherosclerosis, the symptoms are chronic. While when there is embolus that dislodges into the peripheral blood vessels, then this embolus causes acute limb ischemia and it is limb threatening. It can involve aorta, iliac vessels, and femoral, popliteal, and tibial arteries. When it involves tibial arteries, then it mostly leads to ulcers formation and gangrene. When it involves tibial arteries, then it leads to ulcers formation and gangrene. The risk factors for peripheral arterial disease are like other ischemic heart diseases or stroke, like diabetes mellitus, hypertension, sedentary lifestyle, and smoking. These all factors can lead to the development of peripheral arterial disease. What are the clinical features of peripheral arterial disease? We can divide it into 6 P's. 6 P's. What are 6 P's? 6 P's are pallor, paresthesias, pain due to limb ischemia, perishingly cold because the blood flow to the periphery is less, due to which there is cold periphery, and also the pulses are absent, especially the dorsalis pedis artery and the tibial artery pulses are absent, and there may be paralysis due to this peripheral arterial disease. On examination, you can see that there is hair loss and thin skin. You can see there is hair loss over the limbs and thin skin, brittle nails, atrophy of the muscles is also observed. There is a sign known as Burger's sign, in which there is pallor on elevation of the limb. When you elevate the limb, then there is pallor, and when there is dependency of the limb, then there is rubor. In this way, you can differentiate this from cellulitis and other causes of erythema. Intermittent claudication. Intermittent claudication is actually pain on walking some distance, and this intermittent claudication is settled when the person takes some rest. But when again moves a distance, then pain again starts in the lower limbs. What is critical limb ischemia? When the ankle-brachial pressure index, that is the difference between the ankle blood pressure and the brachial blood pressure, if it is less than 0.4, then it is leading to rest pain and ulcers. Then this condition is called critical limb ischemia. How you diagnose peripheral arterial disease? On the basis of clinical features, like I have told you here, 6 P's: hair loss, thin skin, brittle nails, atrophy of the muscles, and Burger's sign. Also, you should check ankle brachial pressure index, and you should do Doppler ultrasonography or CTA or MRA, or in case of tibial arteries involvement, you can go for digital subtraction angiography. If ankle brachial pressure index is more than 0.9, then it is normal. If it is 0.6 to 0.9, then it is mild, and if it is 0.3 to 0.6, then it is moderate to severe, and if it is less than 0.3, then it is actually critical limb ischemia and it is limb threatening. Now we will discuss the management of this peripheral arterial disease. The first thing that you should do is lifestyle modifications. Lifestyle modifications means you should perform healthy activities, exercise. You should quit smoking. Smoking should be stopped. You should control your diabetes mellitus. These lifestyle modifications are necessary for the management of peripheral arterial disease. You can use some medications for this purpose, for the management of peripheral arterial disease, among which are antiplatelet therapy, either aspirin or clopidogrel. Aspirin or clopidogrel can be used, and in addition to these two agents, you can give statin, either atorvastatin or rosuvastatin 80 mg, and xylostazol. Xylostazol is a drug that helps in vasodilation, as well as it has antiplatelet properties, but it takes 2 weeks to produce improvement. So 3 drugs, either aspirin or clopidogrel plus statin plus xylostazole are shown to improve peripheral arterial disease. Sometimes you can add an anticoagulant like rivaroxaban 2.5 milligram BD. Surgical management consists of three things. First one is endovascular angioplasty and stenting. This can be done when the segment that is involved is less than 10 centimeters and more proximal lesion. When the segment that is involved is more than 10 centimeters or it is distal lesion, then bypass grafting is superior to this. Bypass grafting. And the other thing that you can do is thromboendarterectomy in the distal vessels. Thromboendarterectomy can be done when the vessels are distal and also when you cannot go for bypass grafting or stenting. Furthermore, if there is critical limb ischemia and there is gangrene formation, then you should go for amputation. If the signs of life in the limb are not present, then you should go for amputation. If there is a chance of infection, then you should add antibiotics, among which vancomycin and piperacillin tazobactam can be added for the treatment of infections. So this is all about peripheral arterial disease.